Cavity versus root canal versus extraction. Which hurts more? Dentist reveals pain scale. You're sitting in the dental chair and your dentist just said 3 words that make your heart race. Cavity, root canal, or extraction. But which one actually hurts the most? The answer will shock you. I'm about to reveal the truth about dental pain that 92% of people get completely wrong. And by the end of this video, you'll know exactly what to expect from each dental procedure, the real pain levels, and which treatment could save you thousands of dollars in the long run. Let's start with cavities. A cavity is tooth decay caused by bacteria called Streptococcus mutans. These bacteria feed on sugar and produce acid that destroys your tooth enamel. When you get a cavity filling, your dentist removes the decayed tooth structure and fills the hole with composite resin or amalgam. So how much does a cavity filling hurt? On a pain scale of 1 to 10, most patients rate cavity treatment as a 2 to 3 out of 10. Why? Because your dentist uses local anesthesia to numb the tooth nerve before drilling. You'll feel pressure, vibration, and hear the dental drill, but actual pain is minimal. The entire cavity procedure takes 15 to 30 minutes. The cost? A simple cavity filling ranges from $150 to $400 without insurance. But here's the critical part. If you ignore that cavity, the tooth decay spreads deeper into the dental pulp, and that's when you need a root canal. Now let's talk about root canal treatment, the procedure everyone fears. A root canal becomes necessary when tooth infection reaches the pulp chamber, where your tooth nerve and blood vessels live. The infection causes severe toothache, tooth sensitivity to hot and cold, and sometimes a dental abscess with pus. During root canal therapy, your endodontist removes the infected pulp tissue, cleans the root canals with special instruments, disinfects everything, and seals the tooth with gutta percha material. Then you need a dental crown to protect the tooth structure. Here's the truth about root canal pain. On a pain scale, the actual procedure is a 4 to 5 out of 10. Yes, it's more uncomfortable than a filling because the dentist works deeper in your tooth, but modern root canal techniques with proper anesthesia make it manageable. The procedure takes 60 to 90 minutes. The real pain? That's the cost. Root canal treatment costs between $700 and $1,500, plus another $1,000 to $2,000 for the crown. Total up to $3,500 for one tooth. But wait, before you decide to just pull the tooth, let me tell you about tooth extraction pain and the hidden costs nobody talks about. Tooth extraction means your dentist or oral surgeon completely removes the tooth from the jawbone. Simple extractions take 10 to 20 minutes. Surgical extractions for impacted teeth or broken teeth can take 45 minutes or more. Extraction pain during the procedure? About a 3 to 4 out of 10 with local anesthesia. But here's what dentists don't always emphasize. The pain after extraction can be intense. You'll experience jaw pain, swelling, bleeding, and difficulty eating for 5 to 7 days. Some patients develop dry socket, a painful condition where the blood clot falls out, exposing bone and nerves. Dry socket pain rates 8 to 9 out of 10. And the cost of tooth extraction? $50 to $300 for simple extraction, $300 to $800 for surgical extraction. Sounds cheaper than a root canal, right? Wrong. Here's the hidden truth. When you lose a tooth, your jawbone starts to deteriorate. The surrounding teeth shift position. Your bite changes, you lose chewing function. To replace that missing tooth, you need either a dental bridge for $3,000 to $5,000 or a dental implant for $3,000 to $6,000. Suddenly, that cheap extraction costs more than the root canal you were trying to avoid. So which hurts more? Here's the final pain comparison. Cavity filling, 2 to 3 out of 10. Root canal, 4 to 5 out of 10 during procedure, 2 to 3 after. Tooth extraction, 3 to 4 during, 6 to 8 after, with potential for 9 out of 10 if you develop dry socket. If this information is saving you from making a costly dental mistake, do 3 things right now. First, hit that subscribe button so you never miss life-saving health science. Second, drop a comment below telling me your dental pain story. Have you had a root canal, an extraction? How bad was it really? I read every single comment. And third, send this video to a friend or family member who's avoiding the dentist right now. This information could save them thousands of dollars and years of dental problems.
But here's what matters most: the long-term consequences. A cavity filling lasts 5 to 15 years. A root canal with crown can last a lifetime with proper oral hygiene. An extraction creates permanent tooth loss that requires expensive tooth replacement. The smartest choice? Catch cavities early with regular dental checkups every 6 months. Practice good oral hygiene, brush twice daily with fluoride toothpaste, floss daily, reduce sugar intake, and see your dentist at the first sign of tooth pain or tooth sensitivity. Your teeth are designed to last your entire life. Don't let fear of temporary dental pain cost you permanent tooth loss and thousands in dental work. Remember, a $200 cavity today prevents a $3,000 root canal tomorrow and a $6,000 implant next year. Subscribe for more 3D health science that shows you exactly what's happening inside your body.